So I've been given permission to go a bit over time, maybe 15 minutes or so for Q&A, and I'd like to go forward. It's interesting to listen and think about this institution and how the essence of science is to break problems, atomize them smaller and smaller and smaller, and then to deal with them. Research Council does that. And engineering narrows down and down and down. And suddenly we're in medicine, and in medicine the patient is the synthesis of all the problems they come through the door with. And so, in a way, Detroit is, I think, a metaphor for where America needs to go forward. So with this, let me open up for the Q&A, and Dr. Balbus.
John Balbus with NIEHS. Thank you for great presentations and even more for the incredible work that you are doing there. I served as the review editor for the Urban Areas chapter of the IPCC.
Say what that is, please.
I'm sorry. Yes, thank you. For the Intergovernmental Panel report on climate change, for their 5th assessment report on climate change impacts, and this was talking about urban areas. And one of the words that was a really hard word to deal with was the word transformation and transformative change. And it was at the core of the discussion in this chapter. And the people who were writing this chapter were all social scientists, and their focus was very much on governance of urban areas and transformational change in the institutions and the way things were done and the way decisions were made. And with the DC panel, we heard a little bit about, an elected administration that really kind of changed the way things were done and had all these meetings. Could you just comment a little bit about how the work that you're doing in empowering the community is being reflected in the institutions of the city and into a sustainable transformation of the status quo and the way things are done?
I'm going to ask the panelists to pull the mics close and turn them on, please.
I would say one of the ways is in part through workforce efforts to employ in part a different provider type, the community health worker, which is not something that many of us in healthcare have heard about, particularly those on the clinical side. So really understanding that there can be other individuals they can help us with telemedicine. I mean, they can even help us with some of the other cutting edge efforts that are occurring in medicine by employing them, not just employing them as an employee, but also bringing them on as a key part of helping us understand how we engage community members, I think is one effort that helps us to be transformational. And then we have Tech Town. I mean, there are other efforts that help us to promote that transformational aspect. But I'd say one way is through our engagement of our workforce.
May I answer that also? So for us, our effort actually is being led by a grassroots community group, which is transformational in itself, and they have asked us as the organizations that usually have the names that then we fight over who's going to take the lead name and all of that, but IPH isn't going to, which is my organization, Institute for Population Health, or any of the other ones. It's going to be Moses will take the lead, and then there's a group called the Population Health Council, and then there's a group called DEBO that's looking specifically at improving birth outcomes. So it's kind of the approach of the first shall be the last, and the last shall be the first. And so we're really letting them lead that effort. And these are definitely the folks who have ties to people who make policy, people who make decisions. These are elected people who, and so they listen to their constituents. And again, I like to say that the groups that we are working with, their salaries aren't tied to not speaking truth to power. And so that makes it a very interesting approach when you start saying, we need to look at things through a health lens, and we need to have health in all policies.
I would just like to add to that as well in terms of being transformational. I mentioned for one of our initiatives, Henry Ford is very involved with 3 other health systems, the Detroit Medical Center, Oakwood Healthcare, as well as St. John Providence. So we work on some community improvement efforts with organizations that we compete with in terms of market share. So in part, that's very transformational, and that comes from Nancy Schlichting, our CEO. She works very closely with organizations that ordinarily compete. I think another way that we're striving to be transformational, working with Loretta's group and many others, is to take a collective impact approach. So bringing all the players to the table that are involved in taking a very multi-sectoral approach in terms of how do we address these problems. We can't address them the same way by being in our silos. We have to come together at a common table with that shared power in order to truly drive change.
Dr. Spengler.
Yeah, Jack Spengler, Harvard Roundtable member. Exactly on the point that you were just discussing. About a year ago, Kathy Bassi, who's Dow Chemical Company, shared with us, which I thought was transformational and very innovative, of working with the communities in Midland, Michigan, and the counties because healthcare was such a drag on their business. And what she told us is that they actually managed to get a give back of $50 million or so back into the community to look at real prevention or work on real prevention. But I don't know the rest of the story. That's where they were when she shared it with us. Is this being done elsewhere, or what do you know about that particular program in Midland?
Do you know the story?
I can't say I know all the details of the story, but one effort that I know that Kathy's been very involved in is employee health and wellness, and how to drive health and wellness among employees to drive down costs, and taking a very prevention approach. Many employers didn't have a focus on health and wellness. Kathy, as I understand, and her team at Dow have been very, very aggressive in understanding that if they can have a healthier employee group, then they can drive down costs. So, in terms of at Henry Ford, I can share that we have a wellness center of excellence where we have a very robust effort to drive down those costs by very much working with our employees through our completion of health risk appraisals, and then having programs to help drive down those costs. And we see a direct correlation where when our scores go up related to our lifestyle risk score, we also see that it increases productivity and it decreases costs. So now very much a focus on how do we work with our employees, and then how do we then take what we've learned and take that into the community as well.
I'm going to give our speakers fair warning that I'm going to ask you at the end to tell us a story, and to make it under a minute, and to give us a memorable story about how some kind of transformation occurred, whether it came from the community, came from the hospital system, it came from the planning process, but a concrete example of how something actually happened. This will be at the end, but I want you to know it's coming. Please.
Hi, Brett Van Akron from the U.S. Environmental Protection Agency. A comment and a question on two entirely disparate ideas. One, I'd like to say, I personally feel from a creativity standpoint, Detroit is where Manhattan was in 1970, and I think there's going to be a lot of great things that'll come as a result. A comment is one of the ways Manhattan was effective is because government was ineffective and they didn't enforce their zoning laws, and so the artists could actually populate Soho even though it was supposed to be an industrial area. So we've got to make sure government kind of stays out of the way sometimes and let people be creative. An entirely different subject matter. I work on community development with the EPA. I've worked in a lot of communities. One of the things I've found in many communities is that healthcare systems, particularly hospitals, are wonderful civic institutions and lousy neighbors. And the reason is often we have medical campuses, and these medical campuses are isolated from the rest of the community, and they create barriers in the community much the way that freeways create barriers in community, blocking community off. I've worked in Chattanooga where in one neighborhood they had 9,000 medical jobs, and the area was a food desert. And in most places with 9,000 jobs, there'd be a lot of restaurants in the neighborhood offering food opportunities. There was one restaurant, it was a Kentucky Fried Chicken, not what I would call a particularly healthy food option. I understand the nature of a medical facility and how food, how access and being on call is an important thing, but nobody actually thinks to go in, nobody designs a hospital so that the neighbors could actually use the food services in the hospital in a way that is open to the outside. So when I saw what you guys were doing south of the boulevard, at least the renderings, it looked really impressive, and I would love to know more about that and how much engagement. Part of it, the things that I liked you guys had a grid that was open to the public. I like the fact that I saw things that looked like potential cafes on the first floor of the buildings, and I'd like to hear a little bit more about that. And also, you had mentioned the benefits under, I'm going to get a little tech here for people, under the IRS Schedule H 990 form and getting benefits for public health. I'm not sure how much Ford is using that or going to be using that as part of this development.
Thank you.
Well, my colleagues Bill Schramm and Tom Habits would be the ones that you can take a very deep dive on with in order to answer some of those questions. But we understand that, and I think it's really come through very clear at Henry Ford, that health occurs where we live, learn, work, play, and pray, and that we really need to take that comprehensive approach. So whether it's the preparation of food or green spaces or walkable, a walkable community. But let me give you this example as a way to kind of project what the south of the boulevard will look like. In 2009, Henry Ford built another hospital in one of our suburban areas, and this has all the LEED certification. It looks like a northern Michigan lodge. Every room is private. You walk in, you wouldn't even know it was a hospital. It's called Henry Ford West Bloomfield. In this hospital, it is actually a community center where people come to play cards. They come to eat the food. All of the food is prepared fresh. It's organic. Some of it's grown in our greenhouse. Henry Ford actually employed a full-time farmer. Henry Ford Health System employed a full-time farmer. So people see that as a place to come, to congregate, to enjoy themselves, enjoy the food. We actually even have weddings at the hospital. So that will just give you a sense that, talk about being transformational. So that thinking is the same type of thinking that will be applied as we move forward with the south of the boulevard. So how it will exactly look, I have colleagues that can share that. But I just want to let you know what the approach has been for our other facility, and it's just state of the art, and people love to come there, not when they're sick, but they come there when they're healthy.
Mr. Lineberger, you get the hi, Chris, and then Hal.
Dick and Lynn asked me to make a couple comments just to give some backup and some current data for the city of Detroit. I'm a real estate developer, and I run the graduate real estate program at GW. I started the graduate real estate program in Ann Arbor at the University of Michigan. Know Detroit very, very well. And I am thrilled, Dr. Wisdom, that you were talking about terms that we in real estate that are building walkable urban places use, such as complete streets and placemaking and walkability and bikeability and sidewalks. This is absolutely key, and I'll reinforce what Brent just said, if I can knock you the side of the head a bit, all of you, is that the universities have been fabulous anchors in our walkable urban places, starting with Penn up in West Philly, and it's spread throughout the country. Hospitals have been miserable. There's a handful of hospitals that embrace their community, even though they're anchored there. So I'm just thrilled to see that this change is happening. Well, there's also change happening in the city of Detroit. We just, at GW, did a survey of the top of the largest 30 metros in the country as far as their walkable urbanism. And no surprise, Detroit Metro ranked 22nd out of 30. So no surprise, right? That's the current ranking. We have a future ranking looking at future indices and where the area is going in this real estate cycle that started in 2010. And Detroit jumped up to number 8, and it has the second highest market capture of walkable urban development in the country. It is really, in this real estate cycle, it has basically stopped sprawling. Now, it's too early to say if that's going to be a long-term policy or a long-term market trend, but we're seeing that now. And the bulk of the development, we think, from a hypothetical point of view, we think that roughly in most of our metro areas that have stopped sprawling, it's about 12 of them out of those 30, and the others I think will follow next real estate cycle, that 80 to 90% of all development is going to go to less than 10% of their existing land mass. And we know where that 10% of the land is. And so a Detroit future city has nailed it as far as the focus strategy. So we stop sprawling and reuse what we already have. It was a brilliant and gutsy document, highly controversial. Now, it does raise the issue of what do we do with the other 90% of our metropolitan land? But right now, the market is saying very clearly, build walkable urban places. We're going to give you a price premium for it, a huge price premium, which then raises the question of gentrification, because that price premium is gentrification. And so we need a conscious social equity policy. And so one of the things we've done at GW is not just to measure at the place-based level the economics of these places, we also have a measure for the social equity of these places. For the first time ever, there's no other social equity metric certainly that I know. And the next thing Dick and I and Lynn have been talking about this is that something that Kaiser Permanente has approached us on is a place-based public health metric. I don't know if it can be done. I'm not a public health person, though I do have a daughter and daughter-in-law that both have their PhDs in public health. But I hope we can come up with such a metric over the next year or two.
Thank you very much. That's Mr. Chris Lineberger. I'm going to actually ask you to hold off on your responses. We'll go to Hal, and then we have to close with the 1-minuters.
Thanks, Richard. Hal Zinnick with EPA. It's interesting, most of the speakers have talked about stakeholders and partnerships. Excuse me. And the agency obviously is interested in that as it relates to 2 dimensions, disadvantaged communities and sustainability. But over the last couple of decades, and I'll get to my question in a minute, those 2 communities have actually been confrontational. The disadvantaged communities look at the sustainability people and they have their heads in the clouds. That's what we're going to do in the next 10 or 20 years. And they're saying, we need problem solved now. Sustainability community looks and says, well, you're too narrowly focused. You're looking oftentimes at symptoms, not causes. And the solutions you're coming up with are not sustainable. Now, that has been history. I guess my question is, have you guys seen in your projects a lessening of those tensions, or even if those tensions currently exist or not?
Dan, you haven't had a chance to speak, so I'm going to ask you to go first.
Sure. I mean, I think in Detroit there are existing circumstances that make collaboration absolutely necessary, but fraught throughout everything, right? So we've talked a lot about things at this panel so far, but we've not talked about some of the big things, right? Which is that Detroit is a city that's 83% African American. It's a city that has struggled mightily with civil rights issues in the past, where certain concepts and ideas that may forge a long-term, positive, equitable future for the city may appear to challenge a predisposed position on equity in the city, and those things get challenged up front. For sure, for certain, this is something that Detroit Future City has engaged, and so I think in that regard, collaboration in Detroit can be a struggle at times, but it's also incredibly robust. And so within all of that, like that cacophony of noise, and I mean, I've been part of really intense meetings. And I before coming back to Detroit, I'm originally a Detroiter, I practiced in New York for quite a while, and I actually led Columbia University's master plan effort with SOM in Manhattanville in the 125th and Broadway. I'm very familiar with robust and dynamic civic engagement processes, but Detroit takes the cake. And I think when we get into it, though, what we're realizing is that everyone is putting everything they have on the table, and that allows people to know right away. No one's like holding any punches, right? I mean, everyone is in it, and while there may be perspectives that get misaligned or misinterpreted along the way, people kind of work through those issues. And I know for us, as we've moved forward and we've transitioned from the planning into the implementation part of this, we've been able to kind of work through things and dispel myths and rumors around what, for instance, a focused growth strategy might mean for the city overall, and how you can do it well and create a better future for everyone here. We have to apply policy in the right way to that, but you can do it. And how we all can kind of contribute to that process and have a net gain there. I think now as we go forward, though, particularly as the city comes out of bankruptcy, and you see, I think, reinvestment really surging in the city, I think it's going to be really important to watch Detroit over the next 6 months to see how we navigate this terrain, because you're seeing a city that's no longer encumbered by a lot of those the constraints we had before. In the past, for every $10 we had in the city, 4 of them were going to debt service. So when you eliminate that burden on you, you can begin to actually do things. You can push things forward in a way you have in the past. I think we have the opportunity now to do things that produce a much more dynamic and thriving city, but one that actually reaches out to everybody. And I know that's where we're pushing.
Terrific. This is hard. It's got to be a quick story that we can remember, because we're going to close in a minute. So, Dr. Wisdom, you want to start?
Certainly. In Detroit, every year, about 200 babies die before they see their first birthday. It rivals statistics of developing countries like Slovenia. It's an appallingly high infant death rate. A task force was brought together in 2008, 2009. Loretta was part of that task force, her and her team, and we put together a plan. That plan was then funded by the Robert Wood Johnson Foundation, the Kresge Foundation, the Kellogg Foundation, PNC Bank. We were able to pull together about $2.2 million over 3 years to address this appallingly high rate and engage in, community health workers. In the same neighborhoods where we saw these appallingly high rates, we've had 200 babies born over the last year and a half, and we've had 0 deaths in that infant population. It has transformed our communities not just because we see infants not dying, but we see women that are gaining employment, that have gained better housing, transportation, access to food, and are much more in a self-sustaining position so that they can then be part of the problem solving and part of the solution in the communities. That's what I'd consider a transformational story.
Perfect. Loretta, please.
Thank you. In February of 2012, the then mayor of the city of Detroit was facing a consent agreement and looking at an emergency financial manager coming in and the possibility of bankruptcy. He took the very bold step of announcing what services he felt were true municipal services, and those were things like public safety and lighting and garbage pickup. At that time, I was his health officer for the city of Detroit and noticed quite quickly that public health was not on that list. He then zeroed out the budget for public health and ushered in, gave myself and my team the opportunity to create a new way by which public health would be delivered in the city of Detroit through a public-private partnership. We weathered the storm of the whole privatization and all of that, and in that first year, in many cases, we were able to improve the quality and the quantity of services that were being provided to the residents of the city city of Detroit while relieving the city of the ever-growing burden, financial burden that they were under by trying to maintain a health department that they were no longer able to afford. Now, as the city comes out of bankruptcy and is wanting to regain some of those services, it allows us to enter into a new and stronger relationship with some of our other community providers. So we were just pleased to be able, and very transformational, to be able to stand there in the gap, not only maintain the structural public health system, but enhance it, and then be able to turn over what's a better system now that the city is feeling that it is ready to take those services back.
Perfect, thank you. Mr. Kincaid.
Sure. I think what's a very long-term kind of transformative illustration for me in Detroit is the reality that many of the foundations that are present in Detroit's recovery today they're originating kind of endowments, right, and where they come from were part of a Detroit that ended up leading to its own demise, right? This was massive divisions of labor, mass consumption, right? So you think about Ford and the Ford Foundation, right? You think about Kresge, which was Kmart and the Kresge 5 and Dime, right? These institutions kind of enabled one another, particularly in the first half of the 20th century, certainly allowed Detroit to grow rapidly, perhaps too rapidly, and in a dimension that was arguably unsustainable. But overall, that you see those foundations that emerge from that process, right, and foundations end up coming off of those companies and now have absolutely nothing to do with those originating corporations, but they are now present to help in the city's recovery, right? And somehow there's some, I don't know, sublime redemption in that, I think. And you look at the leadership that's in front of these foundations, just really strong advocates for the city at a lot of different levels. And to give you one example of how that transformation has come down, if you look at the bankruptcy that Detroit has gone through, I think most folks are familiar with the statement around the grand bargain, perhaps. This is an unprecedented move where many philanthropic leaders from the Ford Foundation, the Kresge Foundation, the Knight Foundation, Community Foundation for Southeast Michigan, and a whole host of others came together around a strategy that was put forward by a federal judge in Detroit, Judge Rosen, to begin to basically underwrite the art that was held in the Detroit Institute of Arts, which was accumulated through the wealth of that industrial revolution in Detroit, right? And then support pensioners whose pensions might otherwise get gutted in this process. And I think many of us look back on that, and I think in the end, the philanthropy was one part of a much bigger operation in this, about a $900 million move. And that in itself provided the kind of financial and structural integrity that allowed Detroit to go through this process. And for people like ourselves in this panel to sit here and talk to you today with smiles on our faces about how we're emerging, that is transformative. And I'm very excited about where it leads us now. Thanks.
I want to thank this panel for a wonderful, positive, and encouraging vision going forward in the 21st century in this important city. Thank you so much for coming.